I request His Excellency President Rajapaksa to share his thoughts.
Good evening, Excellencies. First, I must thank Honorable Prime Minister of India, Shri Narendra Modi, for initiating this video conference to share our experiences, our ideas, and best practices, and also to understand the challenges we face and further discuss what measures to be taken to combat this deadly coronavirus. Our biggest challenge is to stop or minimize the virus entering into Sri Lanka and control the spreading of the virus within Sri Lanka. For this purpose, we have banned tourists and other people entering Sri Lanka, especially from EU countries and also South Korea, Iran. We did this following the guidelines and statistics relating to the spread of the virus issued by the World Health Organization. We have also taken steps because we have a large number of Sri Lankans working especially in Italy and South Korea. We cannot stop our Sri Lankans coming back to their home country. We have therefore taken all steps to subject those returning to Sri Lanka to a 14-day quarantine period in selected quarantine centers. As it is important to restrict social gatherings, we have advanced the usual April school holidays to commence from 11th March. Further, we have closed all universities and other educational institutes, also with the aim of minimizing social interaction. Our first case was reported in Sri Lanka, was a Chinese lady tourist who since has been cured and already left Sri Lanka. The first Sri Lankan to be infected was a tour guide who had contracted the virus from a few Italian tourists who have already left the country. At present, we have 11 cases being treated in the hospital. There have been no deaths reported so far. We have a specialized infectious diseases hospital, IDH, close to the city Colombo, with intensive care facilities. This hospital has successfully treated even the first case reported. In all other hospitals designated to treat any suspected cases or coronavirus cases, proper personal protective equipment is used. We have also requested those who show flu symptoms to seek urgent medical attention and also self-quarantine themselves. Close associates of these persons showing any flu symptoms have also been strongly advised to be subject to self-quarantine. The area police and the public health inspectors are closely monitoring the progress of the suspected patients. Public health inspectors undertake daily visits to check on these persons who are self-quarantined. We have also established a national task force comprising all major stakeholders with the power and authority to take crucial decisions have been set up and meet on daily basis with close and constant monitoring of all aspects relating to the spread of this deadly virus. A 24/7 office with hotlines has been established to coordinate all activities related to battling the spread of the virus, quarantine and testing and treatment of suspected and confirmed cases. Government of Sri Lanka has taken some additional steps to effectively meet this unforeseen disaster. The Department of Health started giving out health warnings and advice on precautionary measures needed to be followed for prevention of the spread of the virus. This is done through mass media, presidential media division, press briefings, press bulletins, etc. General public were educated not to go for panic buying of face masks, hand sanitizers, etc. This was quite effective. 12 hospitals were declared as suitable for caring of possible coronavirus affected cases across the country. Managing of stocks of personal protective equipment such as masks, gloves, sanitizers and other medical items required for treatment of patients also started. Since the high risk area for the coronavirus was the city of Wuhan in Hubei province in China, there was a requirement to evacuate 34 Sri Lankan students and their families back to Sri Lanka. This was done by the national carrier Sri Lanka Airlines, which flew from Colombo to Wuhan and back to Colombo with all 34 passengers. These 34 students on arrival were immediately quarantined by the Sri Lanka Air Force before they were taken to a military facility in the Central Hills for quarantine for 14 days under the supervision of the Army medical team. None of them contracted the virus and all were sent home on completion of the 14 days quarantine period. At the same time, another 750 Sri Lankans were studying in various universities in different provinces of China and the government facilities. They were returned back to Sri Lanka. These students were instructed to be in self-quarantine for 14 days under the supervision and monitoring by local health authorities. As you know, probably that our parliament has been dissolved on 2nd March and the general elections will be held on 25th April. So the nominations are being accepted from 12th March up to 19th March. Therefore, we had to take precautions to discourage large meetings, large gatherings. But the elections will be held as planned when the World Health Organization, WHO, declared COVID-19 pandemic and indicated that fundamental public health interventions can still limit the spread of the virus and drive down cases even where it was transmitted widely. Advisories were issued for travelers, and precautionary measures were taken by limiting travel overseas of Sri Lankans unless it is essential to do so. Almost all major sporting events, international conferences, meetings, large gatherings have been postponed or cancelled. All schools, universities, and other educational establishments, including schools throughout our country, have been closed for particular periods ranging from 2 weeks to 6 weeks. Even gatherings for religious purposes have been stopped by respective religious leaders, initially for 2 weeks. Also, issuance of on-arrival visas has been suspended for all countries. Travel advisories sent to airlines not to uplift passengers from several countries, mostly from EU countries. Travel advisories also sent that any passenger coming from countries which we have defined will be quarantined for 14 days in Sri Lanka. Sanitizing of public transport also commenced from 2 days back. So because of these reasons, our economy has taken a severe blow due to the coronavirus, particularly in tourism. Most of our tourists are from Italy, Germany, and other EU countries. And now there is a ban on their coming. Our tourist industry was just recovering after last year's April 21st terrorist attack. Our exports are also adversely affected. Therefore, I strongly recommend the SAARC leaders to formulate a mechanism to assist our economies to tide over this very difficult period. I also wish to recommend that a SAARC ministerial level group be established to discuss, share best practices, and coordinate regional matters on combating coronavirus. Thank you, Excellencies.